And we're off. Let's move our bubble up here. I'm Dr. Paul Maximus,
I'm Dr. Bobby Parmar.
and this is your pre-IV Iron Infusion frequently asked questions. We're going to try to squish ourselves into this little bubble. We'll see how it goes. The frequently asked questions are...
I mean, you guys ask a lot of them, but the main one is about why am I doing an iron infusion versus taking oral supplements.
After that, everybody wants to know safety, side effects, how soon will it work, how long will it last, how much do I need, how much does it cost, and then are there any special instructions I need to know before I'm IV? So let's dive straight in. Bobby first, IV versus oral. What's the difference? Why would you want to consider an IV?
I mean, I don't know why anybody wants to consider oral anymore because it takes forever, it's kind of expensive, it causes side effects, and it's inferior to getting an IV infusion.
People often ask, like, how many IVs would I need? Just one. You're in and out of the office in 75, 90 minutes tops. You feel better in 2 to 4 weeks, which oral takes 3 to 12 months. And that's mainly because it's 100% absorption, straight to the vein instead of slowly trying to get past the gut walls. Also, we'll touch base on this. We'll touch on this a little bit later, but the drug benefits make it so that quite often this can be covered by your extended health plan. But it depends. Do you qualify? Well, we need to know what your ferritin is. Bobby, what's the deal with these when there's a reference range that says that anybody who's above 30 for ferritin is unlikely to be iron deficiency? What's the deal here?
If your doctor's ever run this, which often doesn't happen, this puzzle that you're supposed to walk through is often confused by professionals and by people. And they're like, I think I'm fine. But we know that a person is not okay until their ferritin is above 100. That's when you have normal storage of iron.
And it says it right there. So if somebody comes in with a 52 and they're symptomatic, then it's not just because it's not bolded that they're fine. We want to take them to above 100. So let's talk about what those symptoms are.
There's a lot. And we made this cute gradient to show sort of like how symptoms can occur at specific levels of your iron. So you can see that 100 is normal and close to 10 or 15-ish at the bottom is anemic if you get that far. And there's all kinds of symptoms. People get restless legs, you can get headaches, heart palpitations, hair loss. We associate it with only fatigue. That people ask, like, you're not as tired as a person who should be iron deficient should feel. It's not the case, it's a gradient.
And these symptoms don't just start out of nowhere at ferritin of 30 or less. They kick in at like the upper double digits, around 70. And then a surprising one, actually, there's a paper that you'll see on Iron Rex Universe about decreased libido in women and finding their partners less attractive when their ferritins are 50 or less. And so it can be surprising that, of course, these don't all happen in exactly this order and not somebody might have headaches and canker sores. Somebody else might have restless legs, anxiety, palpitations. But if you're reporting any of these symptoms along the way, if you're reporting any of these symptoms and your ferritin's not 100, then you should bring it up to 100 to see if that gets rid of the symptoms. And can we briefly, while we're here, talk about iron deficiency versus anemia?
Yeah. Iron deficiency is when your iron is low. It's totally different than anemia. We confuse in medicine anemia with iron deficiency and say your hemoglobin is fine, and we don't even bother measuring your iron because your hemoglobin was fine. They're two totally different things. One can cause the other. Iron deficiency results in anemia, as you can see here, but they're two totally different things that both affect your life, the quality of it and symptoms.
Anemia basically is the last stage of iron deficiency. It's when your hemoglobin, you can't even make enough red blood cells, let alone that your ferritin has been tapped out for a long time. So just because you're not anemic and your doctor says, oh, you're not anemic, you're fine, that just means you're not at the severe stage, but you still are iron deficient unless your ferritin is above 100. So you qualify if your lab work is less than 3 months old, and it either shows, in cases of simple iron deficiency, a ferritin less than 100, or if you have more complicated iron deficiency, that's iron deficiency with chronic inflammation, your ferritin might be over 100, but then you'd have significantly positive inflammatory markers. We're not going to bother about that for now, but send us a copy of your labs and we'll be able to assess. For the vast majority of people, it's going to be a simple iron deficiency picture. Safety and side effects.
Is iron IV good medicine? Is it safe? Yes. Resounding yes.
Tons of papers on this.
There's a lot of fear around it. It's because of a history of like bad things that happen with old formulations of iron, but we don't use those anymore. We have a long safety record, and we've trained a lot of health providers, including doctors, on administering iron infusions, and we haven't heard a peep because the side effect profile is very low.
If your doctor says, oh my God, you're getting an iron infusion that's so dangerous, you're going to have an anaphylactic reaction, you're going to die, they must be talking about an old iron formulation, because since 2009, monoferric has been incredible. There's 5 in a million anaphylaxis cases, that a likelihood of 5 in a million for anything serious. That's the most serious thing that could happen, is a 1 in 200,000 anaphylactic scenario. Otherwise, there's transient mild flushing in about 5% of people. You feel a bit warm, crampy and warm. If that happens, we're with you. We'll let you know what happens. Basically, we just stop the IV, it passes, and you're totally fine. People continue after that. So nothing scary. And then in 1% of cases, people can get a little bit itchy as the IV goes on, and then we give them an antihistamine like Reactin, and it goes away in 15 minutes. So
side effects are overstated. Serious side effects are, nobody understands that they are extremely rare. They're not going to happen to you, even though everybody who sits in the chair thinks they're going to happen to them. It won't be you. It doesn't happen.
Anybody who told you they're dangerous hasn't read the literature and hasn't administered thousands of them. We have. Everybody wants to know, is this going to hurt my guts? Every time I take oral iron, I get bloated, I get constipated. Nope. You're bypassing the guts, going straight to the vein. You're not going to have any gut side effects. The most common side effects generally are some headache and flu-like symptoms for 1 to 3 days, and that's in about 30% of people. The majority don't even take a Tylenol. We tell them, like, if you need to, take a Tylenol, drink some water, snooze a little bit, go to bed early the next night. Most people are perfectly fine. They don't even take a Tylenol, let alone that they go to work and they function as normal. So unlikely that you're going to experience much. If you do, expect 1 to 3 days, maybe some mild flu-like symptoms. And then anything beyond that, that's less common. You're going to have our number and our email. So of course, text or email and let us know if there's anything you have questions about, and then we'll give you a specific prescription or separate instructions, but that's unusual.
How quickly does an iron infusion work? Some people really fast, within weeks. Some people it takes some time, within months. But the vast majority of people will know how they're going to feel after an infusion within 4 weeks. That we can tell by that point, any symptom that you had that we might think is iron deficiency related should be gone. And if it's still there, it probably wasn't the iron deficiency. So we get to remove it from the puzzle of things that might be going on with you.
Yeah, and I'd say probably at least 80% of the time, people have a number of those symptoms disappear. And then the other 10 or 20% of the time, it either takes a little bit longer for them to look back on month 3 and say, oh yeah, I haven't had a headache in a couple of months. Or for maybe 10% or so of cases, iron was never their problem, even though their ferritin was in the pits and it looked like it would be. But then at least you know you're keeping that iron. That stays with you. It's going nowhere. So it's not like it was a waste.
It can't be understated, too, that a lot of people within days of their infusion, within a week even of their infusion, are like, my life has changed. Thank you.
Yeah, great. How long will it last? Well, it depends.
So some people, if we didn't fix or identify the reason for the deficiency, then you might need an infusion again. You might be vegetarian, you might be vegan, and so the thing that's keeping you iron deficient is going to need you to have another infusion at some point in the future. So we measure to determine when you might need that again. If you're actively bleeding, like in menstruating women, it can take a couple years for the infusion to sort of get out of your system as you're bleeding. And so we measure again 6 months, 12 months to see sort of like where you were at and where you're going in terms of a trend, and then decide when you might need an infusion again after that if you felt the benefit.
Yeah, for most menstruating women, it's 2 to 5 years. If it's less than a year, you're back in our office with that same ferritin of 20 again. Then we should probably have a deeper dive into our discussion around how we mitigate some of those losses. Otherwise, expect it to be a few years. And if you're pregnant, there's an additional video we want you to watch.
How much do I need? So the amount is determined by different clinics differently. We like to use a gradient that if you're close to normal, will give you a smaller amount. If you're farther away from normal, will give you a bigger amount. And we tailor like bespoke medicine here in order to determine whether or not you need the highest amount that we can possibly deliver or a fractional amount of that.
So if your ferritin is somewhere in the upper double digits, then it's a case-by-case basis. We might do 100, 200, 300, 400 milligrams. If you're anywhere sort of midway, then it's 500 milligrams, which is the equivalent of 250 burgers or a half ton of spinach. And then if you're anywhere near the lower double digits of ferritin, then that's about 1,000 milligrams to bring you back up to normal. And that's the equivalent of 500 hamburgers, let alone that if you have iron deficiency anemia, then that would be your ferritin is, low double digits and your hemoglobin is lower. It could be 1,000, it could even be more than that, it depends. And so we'll determine that based on the labs that you send in. People often ask, well, what's my ferritin going to be after the infusion? Well, we tell them for 4 to 6 weeks after the infusion, don't be in a rush to go measure because it's not going to be reliable. But provided that you're at week number 6, you've waited a little while after the infusion, 500 milligram dose of monoferric raises ferritin by about 100 points, and 1,000 milligram raises ferritin by about 200 points. That being said, you don't have to do the math. We do the math for you, and even then, it's very much an approximation of how your body stores either that iron as complex to ferritin, or if your bone marrow turns that into storage in hemoglobin. And so you're going to end up at week number 6 with a ferritin above 100. Generally, it's going to fall in the 100, 200, or 300 range. Even if it came back in the 400s, that's higher than typical, but that's not dangerous. Iron overload would never happen in this scenario, but that would theoretically be a ferritin of 600 or more, 500, 600. Rest assured that 500 or 1,000 milligrams, even 1,500 milligrams, you're going to be in that perfect sweet spot here where you have no iron deficiency symptoms that can be blamed on iron, and any symptoms that can be blamed on iron, and that you're going to have a good buffer here for a couple of years with your ferritin being in the 1, 2, or 300 range. Anything on that?
Okay. Great. How much does it cost? This is a big question, but our answer always is, how much is it going to cost you to not get an infusion? Can you afford not to have one, to just really feel better in your life? Let's see.
Let's math the math, actually. Yeah, go ahead.
So we're naturopaths. So when you see us, you might have drug benefits and you might have extended health benefits that cover our services. If you have those, most of the time, 80 to 100% of the time, by most drug plans. If you're really iron deficient, then we can apply for coverage from the government. And it typically costs between $100 and $550 depending on your dose. Like if you're the lower dose, it's cheaper, obviously. If it's a higher dose, the most you pay is around $550. The infusion cost is somewhere between $250 and $350 depending on where you're getting it and who's delivering it. And it may change over time, but if you have insurance benefits for naturopathic services, that can be covered depending on the kind of plan that you have.
If you're not sure, if you really want to be sure before you book an infusion, you can call your insurance provider, give them the name monoferric, and the DIN is here for you, 024 77 777. And the pharmacist will also tell you if they're going to direct bill your insurance, they'll let you know. If you have no insurance coverage, we use office supply, so you don't have to bother with the pharmacy. You can just come right in for your infusion, and we'll use what we have.
And let's say you have no coverage for anything, the most you'll pay is about $800 to $900. So know that, math that out for yourself to know that it might just completely change your life.
And here's how that math looks. Here's how that math looks. When we compare oral iron, we took the liberty of adding in that if you're not getting an iron infusion and you're going by oral, you might need an extra coffee per day. That's $250 a day. Otherwise, the supplements are directly out of pocket. Nobody's going to reimburse you. That's about $120 for maybe 6 months.
Where are you buying coffees?
I mean, I'd never actually buy coffee. Are they $250?
Like $6.
Oh, Jesus. Okay, so you're going to pay way more.
Unless you're going to Max.
Anyway, so if you're getting Max McDonald's coffee, then $570 or so to replete your iron using oral iron and getting there over about 6 months. And then if you're doing an IV, let's say the drug cost is $550 for 1,000 milligrams. The infusion cost is about $250. in 2 to 4 weeks, you feel so great. You're like, I don't need that extra coffee in the afternoon anymore. So you're saving some money there. That's about $800. So at 6 months, you're paying the difference of about $1.26 per day. And so that's really not a lot for people. And that's why insurance covers it, because your productivity is so much better when you're iron replete instead of iron depleted. That's worth it for them to cover it as part of your work benefits.
You're just spreading it out over time when you're doing it orally. You're doing it all in one go, and maybe it's covered when you're doing an IV.
So don't think too much about the sticker shock. I know it's a bunch all at once, but if you think of it as $1.20 a day over 6 months, you're worth feeling better. So
maths.
And this just puts it back into perspective with your ferritin again. So if your ferritin is upper double digits, you might pay $100 of the drug price. If you're midway, it'll be about $300, and that's a pretty good deal for 250 hamburgers worth of iron. And if you're in the low double digits with ferritin, that's about 1,000 milligrams, about $5.50. That's about $1 a burger. So that's a much better deal than getting there slowly by diet. To wrap up our imploring of you to get IV iron instead of oral iron, if your ferritin is low enough to warrant it, there's ample evidence out there that intravenous iron is more effective, better tolerated, improves quality of life to a greater extent than oral iron supplements. You can read more about this all over the website. And although oral iron is often viewed as frontline therapy, extensive published evidence has accumulated that IV iron is superior in efficacy and safety to oral iron in many clinical situations and should be introduced much sooner in the treatment paradigm of iron deficient patients. That's a lot of blah, blah academic stuff.
We'll get there, maybe in the next few years where the rest of medicine catches up with the evidence. We're not there yet. That's why we're trying to advocate and pioneer this.
And any special instructions, say on the day of the infusion?
No?
Not really. Send us your most recent labs. They should be less than 3 months old. We need to see at least a ferritin. And then if you're in a complicated scenario with your ferritin above 100, but you have an autoimmunity or anything else where your inflammatory markers might be elevated.
You might be overweight. You might be older. You might have chronic infections. You might have other conditions that make it so that we don't actually really trust your ferritin. We need more information to trust it. Then we need these other things to help us understand if your ferritin at a 60 is actually maybe like a 25.
But at minimum, we need that ferritin.
Yeah.
Not even a hemoglobin. We need that ferritin. But if you need a requisition, let us know. We can provide one, and we can book you in for a pre-iron consult to discuss if you have any additional questions that we didn't cover here, anything specific in your scenario that you want to run through before the infusion. Get in touch with our office. Otherwise, book in for an appointment. The IV takes 60 to 75 minutes, 90 minutes in and out. You should have something to eat or drink just in case you're squirrely about needles. It's a really gentle procedure, not necessary to prepare in any way. You'll be in and out, and that's it. Reminder again, if you're pregnant, to watch the additional video that's going to be posted.
And that's it.
See you at Gravity.